My name's Doug Four, and I'm going to present short-term positioning for sideline and sitting positions. Important considerations in sideline and sitting positions for short term. So patients must always have a way to ask for help regardless of how the patient is positioned or what safety precautions are being followed. Safety and comfort and access are always of top concern. Sometimes patients will need to compensate and go into a kyphotic position rather than attempting to sit in perfect spinal alignment. This is just for the patient's comfort. You always want to make sure that the patient is not sacral sitting or they're not sitting in a way that they put pressure on their ischial tuberosity. Before any short-term position is complete, always ask the patient if there is anything that will make them more comfortable with the position. Here's a table of special considerations listed for each position for you to quickly reference while studying for the exam. Here are some more important considerations in both sideline and sitting short-term positions. Erect posture can reduce changes in lumbar and pelvic angles as well as gluteal pressure when compared to slouch posture. This is called sacral sitting and cross-legged sitting. Though it is only short-term sitting, sitting in proper alignment will help the patient learn the proper way to orientate the body through proprioception. They're able to understand how they feel in that posture and how to sit that way, and that's good practice for proper posture and proper sitting. Poor sitting posture has been linked to the development and perpetuation of neck pain and neck pain symptoms. In 2007, studies showed that individuals who suffer from chronic neck pain demonstrate an impaired ability to maintain upright sitting posture. So it would only make sense to help the patient learn proper posture and proper spinal alignment in order to, first of all, decrease the chance of neck pain and neck pain symptoms, and also allow them in the future to sit in upright posture because they do not have that impaired ability to maintain upright posture from the neck pain. Here are some more important considerations for both sideline and sitting positioning. A study on time to cervical stabilization while in sideline position showed that 70.8 of participants stabilized by 15 minutes. This is important to note because the patient may show a lack of balance within the cervical area and could affect any treatment or assessment on the cervical area. When performing therapy in sideline position, it is important to note that the velocity of motions will be less than that of when sitting in the position when patient is using own strength to carry out the movement. So when in sideline position, you are moving against gravity as the patient in order to move your arm. This is also a movement that is out of the norm or out of the regular daily motion for the patient. This was confirmed in a study done in 2003 on the motion and velocity of the upper extremities against varied planes of gravity. Contraindications for short-term sitting and sideline positions. So if the seat is too high, the patient's feet do not touch the floor, the distal thighs are subjected to increased pressure, and the lower back can be stressed. The environment may make an impact on the patient's ability to participate or relax during the treatment. A bright light overhead could possibly be uncomfortable for a patient, and conversely, if a dim light is present, it can make a survival of childhood abuse uncomfortable. There are just various factors within the clinic or within the patient's room that could cause the patient to be uncomfortable or uneasy about the treatment. These are always important to consider because the patient will be sitting in vulnerable positions within the sideline and sitting positioning. Here are the steps listed for short-term positioning in sideline. So put the patient in the sideline position. Underside leg is straight and the hip and the knee is flexed of the top leg. Place the pillow under the head and in between the legs for support and spinal alignment. The top arm will rest on the pillow that is placed in front of the abdomen while the underside arm is placed forward on the body. Check for the patient's comfort, access, and safety. In the video, there's an option of placing a small rolled up towel underneath the lumbar of the patient. This will be demonstrated in the video and is based upon the patient's safety, comfort, and their preference. Here are some reasons for putting the patient in sideline. Some examination techniques require that the patient lay in sideline positioning, and in some circumstances, such as pregnancy, the prone position cannot be tolerated when treating the posterior side, so they would go to the sideline instead. And it's also for visually inspecting the surfaces of the posterior side when prone cannot be tolerated. Here are the steps for short-term positioning in sitting. Positioning of the hips must be back and centered in chair for proper posture. The most comfortable position for a patient is sitting in a chair while the normal curves of the back remain supported. This is proper spinal alignment. A bolster or rolled up towel can be placed behind the small of the back. This will be for lumbar support. If the hips are flexed, a small stool can be placed under the feet. This goes back to having pressure on the ischial tuberosities and the sacrum. Even though it's short term, there still is a possible chance that these areas will become uncomfortable from sitting. So the armrest should be placed at correct height in order to let the shoulders sit comfortably. And in some cases, the patient is able to lean forward on a supportive surface to rest the forearms and head. We'll have two videos showing two different sitting positions in order to exemplify this. And at the end, always check for the patient's comfort, access, and safety. This is the demonstration for proper sideline positioning. So the whole time we want to make sure that the spine is in proper spinal alignment. The student physical therapist wants to make sure that this is done in a few ways. This is going to be done with pillows being placed in certain areas of the body. You can see back here, I'm pointing to where the spine, you need to see where the spine is in alignment. It's going to include the lumbar, thoracic, and cervical. So right here, we're trying to get the cervical to be in alignment by placing a pillow underneath the head. Next, we want to keep the lower leg straight and then the upper leg flexed at the hip and at the knee, placing a pillow in between the knees and ankles if possible in order to stop any pressure from occurring. Then we want to place a pillow in front of the patient. This is for comfort and also for safety. It's also much more comfortable for the patient just to have something there in front of them. Lastly, if the patient wants to have this or you see it's necessary, you can place a rolled up towel underneath the lumbar in order to increase the support and keep the spine in proper alignment. This is proper positioning for sideline position. This is a demonstration for short-term sitting positioning. We want to make sure that the knees are at a 90-degree angle and that the hips are as well, with the patient sitting upright in the wheelchair with the brakes locked. If the feet are too high off the ground or elevated, the patient will be sitting on the ischial tubes and this will cause pressure. If the feet are not enough on the ground and they are dangling, we need to put a stool under in order to keep proper evenly distributed weight through the thighs. Right here we're putting a rolled up towel on the lumbar of the back in order to increase the stabilization and spinal alignment. This is another demonstration for short-term sitting positioning. We're going to ask the patient to lean forward on pillows with their arms like so, with their head on the back of their hands. We also want to make sure that they keep proper spinal alignment as they do so. You can see here that the patient is upright in the chair with the feet on the ground with the weight distributed evenly through his thighs. Now we can perform any interventions or therapy on the back. These are the references for this project. Thank you for watching.